You may think it's just aging, that quiet drop in your energy, that heaviness in your body by mid-morning. But what if it's not your age at all? What if one small pill, something you take every single day, is slowly draining your energy without you realizing it? I want you to stay with me here, because this is more common than most people think. I recently spoke with a 72-year-old man, active, independent, sharp, the kind of person who never sits still. But over the past year, something changed. He stopped going on his morning walks. He felt tired, even after a full night of sleep. By 10 a.m., he was already sitting down, needing rest. At first, his family thought this is just what happens after 70, but here's the surprising part. When we looked closer, it wasn't his age, it was his medication. And this is where it gets important for you, because after the age of 60, your body does not respond to medications the same way it used to. The same dose, the same pill, that worked perfectly fine at 50 can feel completely different at 70. Slower, heavier, more draining. Studies suggest that as we age, our body processes medications more slowly. That means the drug stays in your system longer, and its effects become stronger, sometimes too strong. Now here's where many people get caught off guard. Two of the most commonly prescribed blood pressure medications, Amlodipine and Metoprolol, work in completely different ways, and one of them, depending on your body, can quietly reduce your energy, day by day. But here's the mistake most people make. They assume, if my doctor prescribed it, it must be fine. And in many cases, it is. But medicine is not one size fits all, especially after 60. Your heart changes, your blood vessels change, even your nervous system reacts differently. So a medication that helps one person feel better can make another person feel exhausted. They blame aging. They slow down their life. They accept fatigue as normal. But here's the truth I want you to understand. Constant fatigue is not something you should ignore, and it may not be something you have to live with. Now, before we compare these two medications, there's something you need to understand first, because without this, nothing else will make complete sense. After 60, your body becomes more sensitive, not weaker, just more responsive. Your blood pressure doesn't behave the same way. Your heart doesn't react the same way, and small changes can have much bigger effects. This is where it gets risky, because a medication that lowers your blood pressure might also lower your energy, your heart rate, and even your ability to stay active during the day. But here's the good news. Once you understand how these medications actually work, you'll start seeing your symptoms differently. And more importantly, you'll know what to look for. So let's take this one step at a time. First, we'll look at amlodipine, what it does inside your body, and why many doctors choose it for people over 60. Because what it does might surprise you. So let's start with amlodipine. This is one of the most commonly prescribed blood pressure medications for people over 60. And on the surface, it seems very gentle. It doesn't directly slow your heart. It doesn't force your body into a heavy state. Instead, it works quietly in your blood vessels. Let me explain this in a simple way. Every time your heart beats, your blood vessels tighten slightly. That tightening creates pressure. Now, amlodipine helps those vessels relax. They open up just a little more, and blood flows more easily. So your blood pressure comes down, naturally, without forcing your heart to work harder. And this is exactly why many doctors prefer it for older adults. Because after 60, where arteries become stiffer, less flexible than they used to be. Research shows that this stiffness is one of the main reasons blood pressure rises with age. So instead of pushing the heart, Amlodipine focuses on the vessels, which sounds like the perfect solution, right? But here's the part most people are not told, and this is where things start to feel different. Because while amlodipine relaxes your blood vessels, it doesn't relax everything equally. Your arteries open up, but your veins don't always respond the same way. So what happens? Fluid begins to settle, especially in the lower part of your body, around your ankles, your feet. You may notice your shoes feeling tighter by evening, or a slight swelling that wasn't there before. Now, this is not usually dangerous, but it can feel uncomfortable, heavy, and over time, it can affect how much you move, how long you stand, even your balance. And here's the subtle part. When your body feels heavy, you naturally slow down. Less walking, less activity, and slowly your energy starts to drop. Not suddenly, but gradually. And many people never connect this to their medication. They just think, I guess I'm getting older. But wait, here's the surprising part. Not everyone reacts this way. Some people take amlodipine and feel perfectly fine. In fact, they feel better, more stable, less pressure in the head, fewer spikes. So why the difference? Because your body, your circulation, your sensitivity is completely unique. This is where it becomes personal. Now, there's another thing you need to watch for. Sometimes, when blood vessels relax too much, you may feel slightly dizzy when you stand up. Just for a moment. That brief, lightheaded feeling, that's your body adjusting to the change in pressure. Again, not always dangerous, but important to notice, because small signals like this tell you how your body is responding. Now here's where it gets really interesting. Amlodipine usually does not slow your heart rate, which means if your main issue is just high blood pressure, this can be a very balanced option. But if your heart itself needs support, or beating too fast, then this medication may not be enough. And that brings us to the other side of this story, metoprolol. Because this one works very differently, not in your blood vessels, but directly on your heart. And depending on your body, this is where energy levels can really change. Now let's talk about metoprolol, because this is where things can feel very different in your body. Unlike amlodipine, this medication does not focus on your blood vessels first. It goes straight to your heart, and that changes everything. Let me explain this simply. Your heart responds to signals in your body, especially stress signals. Even small things, like standing up, walking, or emotional stress, can make your heart beat faster and stronger. This is normal, but metoprolol steps in and blocks part of that signal. So your heart slows down. It beats more gently, with less force, and because of that, your blood pressure goes down. Now on paper, this sounds like a good thing. And in many cases, it really is. In fact, research shows that metoprolol can be very helpful, especially for people who have had heart problems before. If someone has had a heart attack or struggles with an irregular heartbeat, this medication can actually protect the heart. It reduces strain. It gives the heart a chance to work more efficiently. But here's where it gets tricky, because when your heart slows down, your energy can slow down too. And this is something many people don't expect. You may wake up feeling fine, but as the day goes on, you start to feel a kind of heaviness. Not pain, not illness, just a lack of drive. A feeling like your body doesn't want to move. And this is where people get confused. They think, maybe I didn't sleep well, or maybe I'm just getting older. But here's the surprising part. It could be your heart rate, because if your heart is beating too slowly, your body may not be getting the energy it needs. Some people even notice this when they check their pulse. It feels slower than usual, sometimes much slower. And when that happens, you may feel lightheaded or slightly unsteady when you stand. Now, this doesn't happen to everyone, but when it does, it can quietly affect your entire day. Less movement, less activity, and slowly your lifestyle begins to shrink. Now, here's something very important. Metoprolol is not a bad medication. In the right situation, it can be life-saving. But if your heart does not actually need to be slowed down, then this effect can feel too strong. And this is where many people find themselves stuck. They are taking a medication that is doing more than their body really needs. And instead of feeling better, they feel tired, drained, less like themselves. But wait, this is where it gets even more important. Because the real risk is not just one medication alone. It's what happens when medications combine. And most people over 60 are not taking just one pill. They are taking several. And this is where hidden problems begin. Now, here's the part most people never hear. And honestly, this is where things can quietly become risky. Because after 60, your body does not respond to medication the same way it did before. Your metabolism slows down, your sensitivity increases, and small changes can feel much bigger. So when you take medications like amlodipine or metoprolol, the effect may be stronger than expected. Now imagine this. Your blood vessels are relaxed, and at the same time, your heart is slowed down. Individually, each effect can be helpful, but together, this is where your energy can start to drop more noticeably. You may feel more tired than usual. You may avoid walking longer distances. You may even lose interest in things you used to enjoy. And the hardest part is this. It happens so slowly that you don't question it. You adapt to it. You tell yourself, this is just part of aging. But here's the truth. Studies suggest that many older adults are actually overtreated for blood pressure. Not dangerously, but more than their body truly needs. And when that happens, energy is often the first thing to go. Now I want to be very clear with you. You should never stop your medication on your own. That can be dangerous. But what you can do is start noticing your body more carefully. Pay attention to small signals. Do you feel unusually tired during the day? Do you feel heavy in your legs or slightly dizzy when you stand? Has your activity level dropped without a clear reason? These are not things to ignore. They are clues, and your body is very good at giving clues if you listen. Now here's a gentle but powerful step you can take. Have a simple conversation with your doctor. Not a complicated one. Just ask, is this medication still the best choice for me at this stage of my life? Or, could my dose be slightly higher than I need now? You'd be surprised how often small adjustments make a big difference. Sometimes, even a slight change in dose or switching from one medication to another can bring your energy back without raising your blood pressure. Because the goal is not just to control numbers, it's to help you feel well, to keep you active, steady, and independent. And this is something many people forget. Now let me leave you with this thought. Both amlodipine and metoprolol can be very helpful medications. Neither one is bad. But the real question is, which one fits your body right now? Because after 60, the goal is not just to live longer, it's to live with energy, with clarity, with strength in your body. So if you've been feeling more tired lately, don't ignore it. Don't just accept it. Take it as a signal, because sometimes the smallest adjustment can bring a part of you back that you thought was gone. And that is always worth paying attention to.